What I've also done is there was a good handout, which is a study done by the King's Promotion Fund, which basically also has been, I think, emailed to you, and the copy of that has been put onto the Learner Management System Moodle, and that is talking about the 9 ways in which the provisioning for the healthcare in terms of promotion provisioning for healthcare is generally done, and that is 1 or 2 slides, I think, towards the end is what we will look at, also referring to with regards to what are the effects it has, and does the whole provision of promotion actually really work within this particular framework or not. And that is what I think are towards the end few slides in the presentation. So starting off with the definition in terms of what we are looking at is, in general, what is healthcare promotion? Now, healthcare promotion is nothing but a process through which I call it marketing, but it's a process through which you enable people essentially to understand the greater needs of how they can look at provisioning for their own healthcare, and also how to help them understand the basic techniques of how it can be used in day-to-day life. And the main aim of the promotions which NHS does, we've seen quite a lot of them, in particular promotions related to, say, sugary products, intake of reduction in terms of sugars, the obesity campaign which has been run in the last few years, the smoking campaign, the other campaigns that we do get to see are all practical examples of how the healthcare promotion is actually done. And to a certain extent, we get to see this in the media as well, wherein NHS sometimes does public awareness campaigns in order to kind of create awareness and drum up support from local communities to be able to help drive this promotion and the message in particular with communities which are affected. So the aim of healthcare promotion is to help the individuals or a group of individuals to achieve a complete state of physical, mental, and social well-being. And that is what is the essence of why these promotions are essentially run. Now, in some cases, what we will get to see is that, for example, if you have patients visiting GP surgeries and they have a specific situation or a specific problem that they are tackling with, I think a lot of youngsters nowadays, we get to see that they are tackling, problems individually at their end. Is, say, for example, a common cause is, say, obesity. And in those cases, the basic message of promoting good healthcare actually starts maybe in schools, through the surgeries, GP surgeries in particular, the day-to-day contact which they do with maybe a practicing nurse, which is in the school, and the awareness days a lot of schools actually do now, in particular, with regards to promoting, healthy eating and in general, balanced diet and things like that. So that's an example wherein, we will look at, these kind of promotions actually coming into our day-to-day lives, and their propagation actually starts, maybe at the school level, maybe at the local community level, maybe in the group level where you are a part and parcel of in terms of social activity and things like that. And they tend to look at meeting, identifying and obviously realizing and satisfying the needs of that particular individual in terms of the help and support that the individual needs to be able to change in general, the overall habits which help him or her to kind of conform to coming to a state wherein they are completely in control of their physical, mental, and social well-being. So what I've seen in general is in practice, we tend to kind of promote this with our kids at home. This kind of thing tends to happen in schools, wherein when you look at the meals, the free meals and the lunches, which are a part and parcel of a lot of schools today, and the promotion of balanced diet in that. So they need to have their fruit and veg and things like that, in terms of milk, in particular for children who are under the age of 5, which is essentially free meals and things like that. So those are things which are being promoted at a very basic level, starting at schools in particular, to try and drum up support, for the concept of healthy living, and in general kind of forms a part of a larger canvas or a part of the healthcare promotion. So it makes it possible, in general, for people to have increased control on the determinants of their health, and obviously, hopefully, in the long run, improve their overall health. Now, what I mentioned to you a bit earlier can be seen in this particular, diagram, which basically talks about how healthcare provisioning and promotion in general happens through a range of activities within our society. So what we have is healthcare promotion in the middle. We do see preventive healthcare services, which are essentially a lot of charities promoting, breast cancer screening, for example, prostate cancer screening, Christie's that you look at. A lot of charities working on that side to look at preventive healthcare services. The second part that we look at is basically looking at organizational development, which is looking at health promoting in schools, which I gave you an example of a bit earlier. We also look at public policies. Recent ones which have been introduced, I think about 2 or 3 years back, is the banning of smoking, in public places, which is to kind of shield and safeguard users in passive smoking, which is users around people around users who are actively smoking. We look at a lot of community-based work which is happening now in different communities, and this is primarily being done through. There is a wide range here. So the mention of the word transport also means that when we look at healthcare promotion, there are a lot of airborne diseases, the levels of nitrous oxide, carbon dioxide that we look at. So that also is, contributor towards a range of illnesses which are now coming across because of our modern day lifestyle. So community-based work services, also look at planning greener architecture, or planning architecture with green spaces, building of houses. When we look at in particular, all these also have an element of healthcare promotion in that there are aspects of it looking at planning, wherein these then help in sustaining a healthy lifestyle, or a healthy, safe environment in particular. We also look at the effects of some of these promotions, which kind of correspond directly to environmental health standards, things like when we look at disposal of sewage, for example, in our beaches. We look at the disposal of wastewater, which goes into sewage. We also look at the recent bill, which is banning of plastic bags in particular in the big four, the Tesco, Sainsbury's, and in general across a lot of retailers. And that also promotes, looks at being one of the elements in terms of how healthcare, health promotion or healthcare promotion is done. We look at basic aspects of healthcare education. So education plays a big part in general when we look at understanding the effects of how education, if this is something which is imparted early in their life, in the early years, this can lead to development of a healthy lifestyle. So education in general, is also a key element in terms of promoting health promotion. And last but not the least, we also look at, one of the elements like economic and regulatory activities, which is things like restriction of sale of alcohol, raising the limit in terms of age limit when we look at the people who can actually purchase alcohol. And we have recently seen in the last few years steady increase in 2 pence, 3 pence, things like that, duty being levied onto, so that alcohol, cheap alcohol is restricted. The availability of cheap alcohol is actually restricted. So these are all different kind of activities which kind of encompass, how healthcare promotion is actually looked at in terms of its propagation and in terms of promoting the whole concept when it comes to England in particular. Going on to some of these elements, what we will look at is they are all kind of depicted by individual slides going forward. So when we talk about responsibility of healthcare promotion, it does not just entirely rest on the state, but it's a shared responsibility wherein a lot of different types of organizations and individuals which are able to participate. And then this is a service which is an integrated service, which is then offered to the public in general and kind of forms a larger part of the healthcare system which helps in actually promoting, better healthcare as far as the society and the community is concerned. Looking at each of these elements, so when we look at individuals in particular, what we are looking at is that the health is actually the well-being in terms of health is actually created in general and experienced by people when it comes to on a day-to-day basis. So from a prospect of looking at individuals, how they contribute towards the promotion of healthcare, what we do get to see is that we get to enact this out on a daily basis in our day-to-day life. And what the government actually does, or the NHS in general, what it does is it tries to promote this particular overarching message of better healthcare or preventive health, preventive medicine in case of in some cases in terms of drugs and diseases. Is that what they tend to do is they tend to promote this concept of the overall viability of good health, which can be done and sustained at an individual level. So one of the key examples that I see here is that, for example, when we catch a common cold, or when we look at, for example, high pollen content and are allergic to it, what tends to happen is some of these basic drugs have been made available, which are over-the-counter drugs, so you can actually get them from pharmacies because it helps in promoting, general better healthcare without having the need to be able to visit a surgery and to get a prescription. So it leads to a bit of cost-saving benefits, and some of these promotions, when they are done, especially during the summer months, when we look at high pollen content, you see a lot of adverts. You see a campaign which the NHS normally runs, which is if you're affected by high pollen content, then you need to be able to take this. It's basically the general concept of the healthcare promotion at an individual level or at an individual perspective. Looking at communities and groups, what we do get to see is that a lot of community health programs are basically targeted with specific communities. And here, a typical example is that when we look at Asian communities in England in particular, what studies have shown is that they are prone to eating a lot of oily foods, and which leads to the development of certain disorders or diseases at a later stage. So the NHS in particular, and in order to promote this message of healthy eating, and to a certain extent, kind of doing away with the problem of obesity, the NHS normally does promotions, which are done at the community level, specifically in Asian communities, to kind of promote, eating of non-oily foods and healthy lifestyle and diet in particular, so that some of these benefits in the long term can help reduce, costs obviously towards the NHS, but also can lead to the effect of a lifestyle change, which kind of promotes more of healthy lifestyle, balanced diet, healthy eating, and leading to less disorders like diabetes, heart diseases in particular. And some of this information is actually shared, through general public awareness campaigns, which is advertising in particular on the mass media like TV, newspaper adverts, and these are done in particular, in order to reach out to some of these specific communities. We do get to see the promotion of this happening within schools, wherein from time to time a lot of charities, voluntary organizations hold talks, seminars at the school level to try and promote the concept of healthy eating, primarily at the kids at the school level in particular, so that they can help shape a bit of personal development and look at healthy eating and healthy lifestyles. An example of that we've come across and seen is that the sunbeds, or when we look at, for example, people want to get a tan, there is a minimum age restriction in terms of which and what kind of people can actually access that without adult supervision. So that is something which is looked at in the summer months when you're out and about on a holiday. I think sun protection screens, campaigns on that are also done, and you normally are able to see flyers in particular, to look at preventing against cancer and things like that. When you're out and about on a holiday, the GP surgery is normally advised that, you should have appropriate protection in terms of a sun lotion or a suntan lotion, which should be applied, especially in the case of children when they're out and about playing in the sun, specifically, during holidays. Is that okay?
Yes, it's much better nowadays. I wish I was at school now. I mean, I got concussed falling off a climbing frame onto bare concrete, and I went on holidays to France and got blistered. So it didn't exist when I was a child.
Yeah, I think some of these things are getting better as we go along, because so what you mentioned is something which I haven't seen also during my childhood years. So yes, there is in particular a lot of let's put it this way, a lot of effort being put in to try and develop this at the school level now, wherein you're able to get flu jabs and things like that, for kids who are under 7 and for adults who are over 60 and things like that, especially during winter months. So there was nothing of this sort, a couple of years back, I think 2 or 3 decades back when I looked at it. So some of these things are new, and I think I think my personal reason of seeing why they are coming across now is that maybe if I go back to my childhood years in the early 80s and 90s, I think there was less air pollution in general. There were less number of cars on the road. We didn't have these weather patterns that we get to see, where it rains for a couple of days, and if it's dry for a couple of days. So these are things which hopefully, when they talk about, the changing weather patterns and how the modern lifestyle is actually affecting the climate on Earth in particular, some of these modern illnesses that I would put it this way have come across is because of the fact that the science and technology has advanced so fast that our lifestyles have become so intertwined with them that some of these are outcomes of what we call modern day inventions in particular. Asthma, for example, I remember during my school days, I had probably none of my friends that had this problem, but when you look at kids going to school now, I think in my own kids, my own son's class, there are 2 or 3 children who are age 5 and they have that problem. So some of these are hereditary, I think, but in general, I think what I've seen is that some of these things have come about because of maybe the modern day lifestyle and technology and the changing, the climate and weather in general because of modernization. What do you think?
Hello?
Yeah, do you agree, or what are your thoughts on this?
Sorry, I was just briefly distracted there with a cup of coffee brought to me. Regarding the improvement of, are you asking if I think that health promotion is vastly better nowadays?
Yeah, no. What I basically meant was that I think some of the things that we are seeing in terms of illnesses is primarily because I think 30, 40 years back when we looked at it, there was nothing of this sort because of less cars on the road, maybe less pollution, less, the climate was much more predictable and things like that. Some of these things which have come in now are primarily because of the modern day inventions and, the change that we've got to see because of, industrialization in particular has also created a lot of illnesses, things like asthma, for example. A
lot of it is a lot of it. There's no doubt that a lot of it is. There's no doubt a lot of it is man-made. There's no doubt about that. I believe that the hole in the ozone layer and we suffer much more ultraviolet radiation because of the fridges and the aerosol cans before they became CSF free and all that kind of stuff, definitely. And I think a lot of the industries, it took a long while before people knew what the coal industry was doing to the miners' lungs. Yeah, definitely. Yeah.
So yeah, that is. I think what we have to do is there is a lot of adaptation that has to be done, keeping in mind the way in terms of the pace at which the technology is growing, and some of these things which are an outcome, positive or a negative, rather than we can't decide at this stage, but maybe more of a negative outcome of the modern technology, which are leading to or diagnosis of or creation of new kind of diseases and new kind of problems which we face. That is where I think the role of healthcare promotion to a certain extent becomes more important. So I know that as I've visited a lot of countries, in Japan, for example, because of the levels of pollution normally that you get to see in China, for example, a lot of people wear the face masks when they are out and about on the streets or shopping and things like that. When you go to Beijing in particular or go to Shanghai in particular, you get to see that the pollution levels are so high that if you're wearing a white collared shirt, by the time you come back in the evening, it's all black. You end up wearing, even as tourists, you end up wearing face masks in places when you go to because of the levels of pollution, or on that day the levels of nitrous oxide, carbon monoxide, and some of the other carcinogenic chemicals are quite high, that it is recommended by the tour operator that you carry your face mask with you so that you're able to breathe properly. If you have problems like asthma and other things, they tend to say that, okay, you don't need to go out today, or you can probably go out tomorrow, or things like that. So these are things that we get to see in a lot of emerging countries.
Could I just say that the radio last week said, back in America, said that whilst Donald Trump doesn't believe much in global warming and thinks that he can perpetuate the coal industry, and he thinks the facts are grossly exaggerated, apparently Donald Trump is against, thinks that there are excessive childhood vaccinations, and that vaccinations probably do cause autism in children, despite what the figures show. So he's got a rather unique belief system in interpretation of the figures.
That is correct. I think my own personal take on that is that he, in fact, from whatever we've known of him so far, apart from his apprenticeship series, as a president, I think some of his views are quite parochial. They're quite, quite stark, and they tend to be on the extreme sides, So the revival of the coal industry, when Obama is he signed that, okay, there'll be no more new coal plants, and they'll be shutting it down to achieve the Paris Climate Agreement, which was signed. His administration, I think they're kind of hell-bent on the fact that they want to reverse a lot of things which the previous administration has done. And my personal thinking is that, to a certain extent, because now of the discovery of shale gas, and I think the resources in general, economic resources in general, being very scarce now, I think it's a larger policy wherein America wanted to kind of safeguard their own natural resources. So at a stage when it comes to dependence on oil and resources like these to drive the economy, they will have enough internally, and they've kind of run the others, across the world bone dry by looking at either invasions and things like that. So I think it's a very vast topic. It is quite, I kind of find it very, I don't want to use the word hilarious, but I kind of, I think because we've had somebody who's now started to take a very different stance as against the traditional or more conventional stance which were taken by, the previous presidents, he tends to get a lot of attention. That is one. And second, people are interested in finding out what his views are because he's very new in his position. And there is a sense of curiosity around his old presidency at this moment. So there are lots of U-turns which I expect will happen, like the transatlantic treaty after the meeting with Angela Merkel. So he's put UK behind Europe in terms of doing a favorable deal or a treaty with as far as trade is concerned. I presume as his knowledge as a president grows and he gets briefings internally by the think tanks, there are expected to be a lot of U-turns which will happen during the course of his 4 years. But it's quite interesting, I think after a lot of years, and I'm quite curious about this, and I'll be honest, I tend to watch most of the American channels now just to understand what he's doing and what he's trying to do, rather than maybe tune into the BBC or Sky. It's the occasional, which was the other way around, watching BBC and Sky and then going through Fox News and others just to see what's happening. But now it's Fox News, which is the main channel, and then tuning into Sky and BBC just to see what's going on in our country. So there's lots happening, but I think in general, curiosity around the kind of policies that he's trying to come across with and his views in general. A separate topic, we could have another session on this, totally honest. I'll leave it at that if that's okay. Going back to the slides that we were discussing, so just looking at briefly the role of non-government organizations, in particular. Here, obviously, a lot of non-government organizations which work very closely with the NHS and in England, in particular, to promote the healthcare promotions and campaigns, include a lot of charities. They include say, for example, I've put it in red, the British Heart Foundation, the Cancer Trust, and the King's Fund. A lot of studies, are done, I think, every 2 years by some of these trusts and obviously charities, just to bring out data. And I think one of such polls that we will look at towards the end will be the YouGov study, which was done across, I think in 2013 or 2014, which I've taken the data across from, which did a survey wherein, again, some of these campaigns, promotions on which the NHS spends money, they look at evaluating the effect of these on a long-term basis. But short surveys and things are done every 2 years, every year in some cases, to try and see if they are having the desired effect in terms of achieving the objectives for which these campaigns are done. I think at the governmental level, what we do get to see is that there is a central budget which goes in through the NHS and through the NHS Trust and Foundation, which is stipulated towards this, healthcare promotion campaigns in general. And I think it was 60 million in terms of money being appropriated towards this last year, as per the NHS website. And this is then distributed to at the local level, to the councils, which also play a key role, in obviously promoting healthcare promotion. So some parts of this budget from the NHS actually trickles to councils, local authorities, voluntary organizations, and some part of it is directly funded through government, for charities like Oxfam and Christie's, which also keep the national goals in mind, which are termed, as non-government organizations, but they work very closely with the government to meet certain goals, which are kept in line with the national goals. And those goals then are worked in terms with the international organizations like UNICEF, WHO, and things like that. So we see the trickling of that budget happening, in various forms, but predominantly it's utilized at the local level by the councils, and some bits of it then trickle down to, for example, a school level promotion as well, or a day being organized in terms of a seminar within a community, and that is where that fund actually ends up being used. Mentioning the international organization, so the overarching objectives, of promoting healthcare promotion to a certain extent are kind of, they are similar, and they are worked in tandem with some of the international organizations like United Nations. You look at the World Health Organization and UNICEF in particular, and these bodies at the international level help in promoting, global health, global healthcare in particular, and at different levels, in different countries, in different continents, these organizations play a different role, and some part of their funding is done through the aid which UK also gives out to these organizations on an annual basis. This was in the news, I think, day before yesterday, when Theresa May actually said that there's not going to be any change in the level of aid which the UK provides to some of these international organizations. This is something which is interesting, is that to a certain extent, certain countries which are now growing quite fast, they are developing countries, they have GDPs in excess of, or are classified as, emerging economies. There is an interesting debate which has been happening wherein it is being said that we should not contribute, obviously providing these funds in general. It should go across to the more underdeprived or, countries wherein this is required, like this now going to, so I think the aid going to China was stopped in 2015, October. There is similar proposals which are currently now being put in place wherein they want that aid to be stopped going to India because they recognize that India is obviously a fast-growing economy. It's growing at about, I think, 7.5% fastest this year. And I think about 231 million pounds worth of aid actually goes to India for various charitable causes. And there is a lobby which is currently now going to say that, okay, this aid could be put to better practice in terms of promoting healthcare, hygiene, other aspects of what has been set together as objectives by these international organizations which UK is a part of, to try and send this aid to much needed countries as against a country which is growing, and is going to be self-sufficient in a number of years. So, at the international level, so what we do get to see is the healthcare promotions which are happening. You're looking at one aspect of it being international, that some of the aims and objectives of these are synchronized at the national level within the UK with some of the international agencies or organizations abroad in terms of promoting healthcare in general and the awareness of healthcare promotion in general with these organizations in areas which are called deprived areas or countries which are developing countries. This is a slide we basically explain that, but kind of covers it what I mentioned earlier, that the United Nations obviously has a key role to play, and some of the other bodies like the World Health Organizations and the Children's Fund, UNICEF. We've seen brand ambassadors. We see campaigns often on a daily basis, wherein Oxfam, for example, UNICEF, they basically request for funds, and they are predominantly going to provide clean drinking water, which is identified as a source wherein a lot of waterborne diseases actually happen at the young childhood age, because in a lot of developing countries, especially in Africa and other countries wherein clean drinking water is not available, so the international organization's role in terms of promoting healthcare promotion and promoting healthcare in general starts by synchronizing with the aims and objectives of the healthcare policy in the UK and how it supports these objectives in other countries when it comes to aid and other charities like Oxfam in particular, working with these organizations to provide aid and all the other resources in terms of money to promote this concept. Now, the other thing that we will look at is, which is important for us to look at, is basically what are the approaches and strategies what can be adapted. When we talk about this concept of promotion, but that's quite general. How do we look at this in a bit more detail, in the specifics of it? So the specifics of it, we look at in the next few slides, which start from here, is looking at understanding how healthcare promotion actually helps in improving health of an individual, both at the community level, and also helps in changing the behavior, which negates the negative influence on health. And some of the strategies which are developed out of the National Healthcare Promotion Strategy, and that's the handout which I've sent across to you in the email, which basically is a strategy document which was produced by the King's Fund, I think in end of 2013-14. And that is what highlights the various ways in which this promotion is actually it's promoted at the individual level, at the community level, and how it is managed at the national level. It comes across to the next slide, which is a framework that we will look at. So here they've developed a framework which is primarily looking at three levels. One is individual, the groups of the community, and in general the population. And the focus of these strategies at this three in different levels is to look at bringing across change in the lifestyle and the behavior in which we adapt or consume this promotion strategy. And the stress primarily is on preventive, medicine, and how in general then it's becoming a part of public health. This is then expanded into something called the behavioral adaptations, which lead to changes in behavior. And on the other side, it is the environmental adaptations, which is looking at, changes to environment that promote health. In effect, both of them coming to promoting better healthcare and quality of life. And looking at this slide, how we find lifestyle and behavioral approaches are basically concerned with individuals or groups to look at targeting groups which are at risk, in particular within the population. And a current example which I shared earlier was the problem of obesity, which various studies, have kind of prompted that by 2050, 80% of the young population in the UK is going to be obese if the government does not put strategy in place to kind of reduce, the intake of sugar, the intake of fatty foods, alcohol, and a couple of other things which are a part of the, the framework of promoting this national strategy. The other thing that also is being looked at is how to improve, in general, the healthcare by other, aspects, which is looking at reducing, say, smoking, poor nutrition, or maybe, the flip side of that is the 1 in 5 kind of an approach, which is have you eaten your, the fruit and veg, in terms of promoting healthy eating lifestyle. And in the other part, which is quite important, is this physical inactivity. Because of our modern day lifestyles nowadays, what we do get to see is that most people who are working in the offices have a sitting job. And in general, this leads to a lot of physical inactivity. And the idea to promote, healthy lifestyle is primarily through the route of, gyms, walks, marathons, things like that. So a lot of these healthcare promotion outlets that we get to see is one of the key things we had, I think, yesterday was the London Marathon. So some of these key, activities which the government actually promotes also have direct relation to, the healthcare campaigns or promotions which are done, and the organization of some of these events like the London Marathon, the Manchester Marathon. I don't know about other areas, but in general, these initiatives are looked at to kind of deal with the problem of physical inactivity, in particular within the society because of our modern day lifestyle. And some of these approaches are then, married with health education, social marketing, and the promotion of, let's say, the promotion of healthy lifestyle, in particular through the channels of social media marketing. So when you look at NHS and when you look at some of the charities, they tend to promote a lot of their messages through social media nowadays, which is through the creation of Facebook pages. And this is where, a lot of information in general is put out in the public interest, in the domain of the public interest, to try and refer to this information, because they generally feel that we consume now news and media, information through a lot of different mediums. And social media has become a very important medium through which this information is consumed by a large set of people. So a lot of information is now put out by NHS, a lot of these charities, organizations that work with NHS in order to promote, healthcare in general, is put out through that medium of social marketing. Any questions on this so far?
No, I was just going to comment on, again, the TV week before last just showed in Manchester, I think where you are, the drug addicts didn't know how pure their drugs were, and was quoting that the opioids varied between 0.2 and 5%. So that if it was a strong dose at 5%, they're often found on the floor because they don't know how strong it is.
That is correct. I think there was in general some news about the coverage of synthetic drugs, or I don't know whether you're referring to that, but the circulation of one of the types of spice or spike, something like that, which is now in circulation in Manchester, which a lot of youngsters do end up taking. But yes, substance misuse in general, yes. I get your point there. What you meant.
Are you referring to so-called legal highs?
Legal highs, that's correct. Yes.
Legal
highs, yes. With the use of drugs like ecstasy, there was a synthetic one which was kind of I think it led to the detection through a raid, wherein it was confiscated by the police, which could have got into circulation in the Greater Manchester area. Yes. Those kind of things, definitely, and there is a lot of public awareness campaign which is happening in Greater Manchester at this moment with regards to the use of these legal high or drugs which kind of promote legal highs, especially within the youngsters, in the teens in particular. So that is happening, and that is currently also being done because a lot of teenagers end up using them just for the sake of using them, and then end up being in hospitals and things like that. And again, it is down to what the police and the local authorities are saying. It's down to education in particular, because some of them are not aware that these can lead to these kind of effects, or after effects, if they are taken without prescription or without supervision.
Yeah, perhaps it's just because Manchester's picked up on it more than the others. Perhaps these things are worse in other cities. I don't know.
It's something which is definitely a point of discussion now, in particular with looking at the misuse of these legal highs in teens in particular, and youth in particular. And what they're saying is, in general, this is primarily it is an outcome of a lot of things which is predominantly happening in larger cities because of not enough jobs being there, and people not able to find work and things like that, which then leads to this particular outlet wherein they end up taking this in order to kind of let's put it this way, deal with stress and situations in their personal life. So I've only read about it, to be honest, in the news, but yes, it is in general. We've seen this come across in the last 6 months. There were 2 or 3 articles or 2 or 3 flashpoints in terms of the news, which were one covering in Birmingham, I think, in the month of January, February, and then Manchester was in it very recently. There was one, also one of the coverages indirectly related. I think it was done by the series Panorama, which was looking at this particular thing in Glasgow, which was it had a little bit of a different topic, which was life under benefits and benefit cheats, but it did have a section of this called the legal highs, or the substance misuse and the addiction on the rise in areas which are deprived areas, specifically in larger cities like Glasgow and Manchester and Birmingham. That brings me to the next slide. I'm going to kind of try and see if I can go through some of these slides, because some of them are self-explanatory. But the government actually looks at providing two concepts. One is self-help and the other is self-care. Self-help is the use of strategies to manage one's own health problems rather than seeking professional help. And self-care is the concept of caring for oneself or a friend or a family member, rather than using the care traditionally provided by healthcare professionals or providers in general. And this is something also being promoted, wherein the awareness of how some of the common illnesses and problems can be taken care of, if you have the education and knowledge about, can be done under self-help. And in self-care, obviously, some of these things can be taken care of when you're trying to put less stress on resources, the public resources in particular, and the same kind of care could be provided by one of your friends or one of your family members, because they're aware of the situation and can be effective in dealing with the situation after they've had a bit of help or coaching or education from maybe a local authority, the GP surgery, or a seminar or something like that. Coming to the next slide. So basically, in some of these slides, what we are talking about in general is what are the strategies which are being put in place to kind of promote, healthy lifestyle, and that takes the roots to the healthcare promotion. So here, again, the fact is, the example of smoking, which has been identified as one of the significant causes which can lead to, cancer at some stage or some sort of other associated diseases, can actually be prevented if the benefits of non-smoking are spoken about, or you help smokers who want to give up smoking, help them to primarily give up smoking effectively so that they can bring across a change in their lifestyle, which promotes, healthy living, and obviously leads to less percentage of them being diagnosed with long-term diseases, in the future. And one of the key things which, NHS has looked at, because there are a lot of doctors which have gone to, Australia in particular, what they've looked at is individual lifestyle approach, to the healthcare promotion, causes, certain amount of morbidity, mortality within Australia as diseases resulting from poor lifestyle behavioral choices. So there was an interesting study which has been done with regards to comparisons between the National Health Service here in the UK and in Australia. And what it came out was that certain parts of, certain types of effects which people experience because of poor health are down primarily due to the type of lifestyle they adopt, as compared to, the choices which could have been done, which could result in not having these diseases in the long term, or these situations in terms of the long term. So this is picked out from the handout which I've uploaded on Moodle. There are two, in fact, on the email I sent you one, but on Moodle I've uploaded two, and that is, this is something which I picked out from that handout, wherein what they say is that it is down to picking up an approach which basically also helps you to have a healthy lifestyle as against, the development of some of the diseases which are genetic or could be hereditary. But if you pick up a good lifestyle in terms of a lifestyle which generally promotes individual, better living, and in terms of, better habits, can also kind of then negate some of the hereditary diseases or effects which you could have in the long term, which primarily get transmitted. So this is also one of the approaches which is currently being applied, wherein, for example, when we look at a campaign, 23andMe, I don't know whether you've seen that on TV. So there's a company which is 23andMe, which you can actually buy a pack or a kit, and it helps, basically it studies your genome and tells you about the disorders or, basic, let's say, diseases which are genetic in nature. It can help you predict that because of your background and where you come from, these are things that you could be prone to, or these are things that you can develop at a later stage, and that in general can help you promote a better lifestyle or a living, from a point of view that if you're aware of these things which could happen because they're genetic or hereditary in terms of your family tree, then they can actually be negated by change of lifestyle at an early age, in terms of, promotion. So the promotion of some of these services has been made legal because they tend to have a positive impact as against a negative impact on the individual's lifestyle, and also in terms of promoting long-term, general well-being or good health. Have you seen that campaign of 23andMe?
Seen the campaign of which? Sorry.
There is a company called 23andMe. It's
23andMe.
23andMe, yeah. It is basically a company which allows you to do your genetic testing and analysis, and you can buy a kit. I think it's about £149. When you buy that kit, you can get to know your health and ancestry in terms of some of the general conditions. So what they do is they diagnose your genetics and your genome, study it, and then can also report on over 100 different type of conditions, which could be either hereditary or could develop because of your lifestyle.
Oh, that's I didn't know that. I did know that. I knew that the pharmaceuticals manufacturers, e.g., I went to an asthma risk factors, and I did know that there was the companies had already invented genetic chips, but I didn't think they were on public sale.
Yeah, I think this is the one which I've just Googled it on, and I've seen this. They have been advertising on the TV, quite aggressively, and it's available through Amazon. It's a DNA screening test, which allows to kind of detect your let's put it this way, hereditary risk factors which might lead to certain conditions in the future. So I think it's priced at about £149 or so. Definitely see it somewhere on Facebook as well.
So presumably all the United States are sending their analysis to Britain to get their answers.
That's correct. Yeah, that's the first link here. Yeah, it says 149. Yeah, I missed that out there. So it says basically get to know your ancestry. You can do one over health, 100 health conditions and traits, and find out about your inherited risk factors and how you might want to respond to certain medications. So at 149, it's a comprehensive set of tests and reports, which obviously is
yeah, this should be out. I mean, it should be outlawed in the UK. I mean, I was told that there was no, generally speaking, that screening is only justified if a screening program is justified with the Wilson criteria or something very closely matching. But
right.
Blind screening, I can't see that Wilson's criteria are justified in that kit.
I don't think so, no.
Because if you pick up a gene that you can't treat,
yeah.
Wilson's one of his first criteria is that there must be some form of influence on disease progression to a beneficial direction. So if they identify a risk gene that for, say, Huntington's chorea or something in it, then it's a waste of time. It's just causing worry. Yeah.
Yes, that makes sense. Yes, I think. But when I did the search right now, I was a bit surprised myself when it came up with that it's been banned in the US, but launches in the UK. So, yes, certainly these kind of genetic or DNA testing kits should only be made available under specific conditions, wherein they know that for sure that if this is going to lead to maybe some sort of a disorder, then only those set of people should be allowed to basically look at doing this testing. But then again, it's something which I think is currently being promoted on the TV. I've definitely seen this on Sky, during Sky News as well. That there is a campaign which they're running, which kind of say, get to know your ancestry and the kind of genetics you've inherited, which would help diagnose certain type of disorders and diseases which are more prone to developing because of the lifestyle or because of your genetics in particular. So an interesting point of discussion. And I'm very curious. I might end up ordering this at my end because it kind of you're just curious, because I think a lot of people are looking at now in general about after a certain age you want to live a bit longer, and obviously you want to be able to find out if the science is available, that what kind of things would affect you because of your hereditary or genetics in particular, and you want to be maybe do a bit of preventive medicine to try and see if you can avoid these in the long run, which could help save you healthcare costs, and obviously going under the going for an operation or things like that. So yes, I think there'll be a few people who would end up taking this, out of curiosity. Some of them might do a serious, introspection into it and say, okay, yes, I've got a family history of 1, 2, 3, 4 different types of disorders, and this is something that I could look at, which would help me maybe save a bit of healthcare costs and other things in the long run. So, yeah, interesting thing to look at maybe, but coming back to again slide. I think looking at some of the healthcare promotional strategies, I've skipped a few slides in particular because I think they are self-explanatory, and those are looking at the individual strands or individual boxes that we've discussed here. Maybe a bit of reading that you can look at. Coming back to the healthcare promotional strategies, there are three in particular which the NHS is trying to promote, and these basically are employed for all healthcare promotional campaigns. So one is they're looking at, in general, promoting enabling. That means anything which enables better health, a better lifestyle is something that they want to help promote. They are looking at creating environments that support the promotion of good health. So things like gyms coming up, communal activities being planned. One of the initiatives is bike to the office. Some of the employers do end up giving, a reimbursement in terms of incentive if you bike to the office. And that could be claimed back through the council by the company in terms of providing you the cost for the bike, things like that. And then also advocating the creation of essential conditions for health. So in general, there's a lot of discussions with councils around the encroaching of green spaces in and around cities. And this is also married into the, closely married into the objective of looking at environmental healthcare promotion and environmental effects of environment having an effect on health in general because of the green patches disappearing in our cities. This is an example of looking at one of the campaigns I think which was done, which is it's trying to propose that you're looking at after a certain age, I think the NHS does prescribe that you get screening done for breast cancer, and this is a public awareness campaign which they've done, I think, in the last couple of years, wherein they actively promote the the process of cervical, breast, prostate, some of the other basic things, wherein they could see that there could be a development of certain diseases in particular. So they look at the route of promotion in general to be able to promote certain aspects of preventive medicine. And because it's predominantly a stigma in the case of Asian communities, so this campaign, which is screening for breast cancer, is predominantly done within magazines, flyers, articles across GP surgeries, local community offices, community centers in particular, so that they can promote this within the Asian communities, because they shy away with the idea of getting the scans done. So this is an example of obviously one of the forms of promotion, which is print advertising or a flyer, which has been done in the past as far as the breast cancer campaign is concerned. This is what I was alluding to a bit earlier with regards to the 9 areas which Things Fund has actually looked at in terms of the healthcare promotion framework, which is something which I've uploaded on Moodle, and here it talks about the 9 key areas wherein they're trying to promote the development of better living and personalized, which is primarily things which are picked up from the slide here. So there are 9 areas things like best start in life, which is basically talking about the immunization which happens at the early age when you have children or when you are a child, essentially. Looking at promotion of some of these concepts within schools, and to a certain extent that it leads on to even to the aspect of provide when Theresa May says the government should work for all all sections of society. So this is where it also has a long-term effect in terms of if you are in work, it generally has a positive rub-off in your lifestyle. And so one of the key areas identified is that helping people find good jobs and stay in work for longer. Trying to promote active and safe travel, which is the use of more use of public transport, cycling, and other non-polluting means to be able to travel to place of work or from place of work. And then again, environmental effects. So these are environmental effects looking at insulation within homes, warmer and new eco-friendly homes which are being planned, the use of solar panels which is being promoted. I think the duties, the kind of rebate that you can get if you have solar installed nowadays in homes in particular, you can save on a bit of pricing on the electricity. Schemes like these are a part of also the healthcare promotion. You have access to green and open spaces. You're looking at obviously stronger communities which are stronger because of the well-being and resilience, which is to look at, again, the promotion of development of community facilities like gyms and other things which help lead a healthy lifestyle. There are other areas which are being looked at, which is public protection and regulatory services, which talk about, including the use of, I think, the consumption and the use of sugary drinks, alcohol, takeaways, and even looking at air pollution and other things which can contribute to environmental pollution, and that could in turn have effect on the health of an individual. And last but not the least, healthy planning, which is again looking at planning of these green spaces, land being made available for new housing. So there's a balanced approach wherein you tend to retain the green space, the new housing being put in place promotes, there is good planning around it in terms of making sure that all the facilities are made available, whether be it in terms of schools, the NHS, medical facilities, community facilities, and things like that. So these are some of the areas which have been identified as in the national framework for healthcare promotion by the King's Fund, which I've kind of put across on the slide, and the detail in terms of the nuts and bolts of the article are in the case study or the which these are two tables which I've taken out, which kind of give us some snapshot in terms of whether these promotional campaigns, do they work, at what level they work, what impact they have. And say, for example, when you look at something like health promotion of the concept of good health in schools, you look at the scale of problem in relation to public health is the highest, because we're able to get them young and get them educated at the initial levels of their at the younger age, then that could have the highest effect on tackling this problem of public health. It also has given evidence that it has the highest kind of uptake if this is promoted during the early years, or amongst the children in the early years when they are in school. The impact on the health is highest, obviously, because they tend to develop those lifestyles which make them into being adults. And if the lifestyle development could be some of the parameters which are required for the development of a healthy lifestyle could be done at the school level, they could have the highest impact on health, because in general, if you've taught the young child having eating a balanced diet and things like approaches like that, then they tend to have a good and high effect as far as the development of lifestyle is concerned in the future. And some of these things, with regards to the measures which are being introduced, and then they are classified across these 5 different parameters in terms of direct impact on the problems, have been kind of summarized in the table. That's the end result of the study, which I picked up from this article towards the end, I think. Yep, there they are. So what they've said is basically over the years, some of these things which have been put into practice have had this particular effect with regards to, and that is how they rate in terms of having an effect on the impact in terms of the lifestyle and the individuals in general. So I've been summarized in this particular table. Any questions on this so far?
I'm just absorbing it. I safe travel.
Right. Okay. Safe travel. Okay.
Public protection. So safe travel, public protection is higher than the best start in life.
So So best start in life, and when you look at active and safe travel. So when you look at this is the table. The first table shows basically the direct impacts of these initiatives and how they classify across these parameters. And the table second basically shows and talks about the indirect impacts these actions can have on, and how they are ranked. Whether they have a high impact, low impact, is being ranked across this table. So best start in life, and with regards to public protection, the indirect effect of, healthy lifestyle or promotional campaigns is lower when it comes to public protection. And in the case of safe travel, again the impact is higher. So that when I look at, in particular, how do I explain this is, when you look at the indirect effect of the framework which has been put together.
I'm with you. Yeah, I'm with you now.
You okay with that?
Yeah, I think I've got it now. I think I've got it. It's yeah. I think I was spending so much. I was thinking about the because they were saying that if you use your mobile phone at the car, it's now a statutory 6 points and a fine. But I was wondering whether that contributes. I mean, presumably that is to improve safety and health on the road.
Yes, I think what you said is a very, very important point, and I think there's a lot of discussion happening around this in the last few weeks. But some of these things, what you mentioned, is an indirect effect on, maybe it's not been classified here because this is a study done in 2014, 2013, 2014. But when it is refreshed, the idea would be that this public awareness and the promotion being done, that the use of mobile phone is a strict no-no, and the kind of fine and the points that can be put on the license is hopefully going to end up, kind of promoting safety on the roads when it comes to, driving.
But I can see that from that chart, active and safe travel is lower than nearly everything except for access to green spaces. So they only think that travel issues are the only thing that travel issues are more important is than green spaces.
To a certain extent, yes, but I think from a point of view of this particular study, what they've done, I know we are trying to relate the public, road safety with regards to the health safety. So I think one of the it could be a difference in the objectives here, that we are talking in two different contexts, primarily because that is also something which the government is trying to promote. And what they're saying is the use of mobile phone behind the wheels is absolutely, not permitted, and leads to, obviously a lot of fatalities on the road. Should be avoided by, increasing this fine and the 6 points on the license. Might be slightly different from this is because that inflection, might not have been incorporated in the framework when we look at, road safety in particular, or because of the use of mobile phones, when this particular research or when this particular framework was initially developed.
Is that King's Fund 2013?
2013, yes, that's correct, yes.
Yeah. All right, no, that's it.
It is definitely 2013, yes. So this was 2013. So there could be a new edition or a new version of this. If that's come out, then we'll have to wait and see if they've incorporated the road safety feature of this into the framework as well, and because of which maybe the change which has come across is, the 6 points on the license, the £1,000 fine and things like that, to kind of dissuade drivers from using the mobile phone when they're driving. And I think it recently came across because of that incident wherein the lorry driver actually, one of the reasons why the lorry driver actually went into when he was looking at his mobile phone, and it led to the tragic death of, I think, 2 or 3 children in particular, with the family going on a holiday or something like that. I think it was 2 or 3 months back, which was in the news quite a lot. So the reason of putting these views across was the idea of referring to this handout was to look at the specific areas which I wanted to pick out, wherein currently the National Framework for Healthcare Promotion actually looks at 9 particular areas, and how they see this as a short-term and a long-term, having some sort of a short-term, long-term effect on, in general, the health outcomes or the healthcare promotion outcomes, and the areas in which they feel it is relevant at this stage to try and promote and spend money so that it can lead to the development of, healthy lifestyle, and obviously overall improving public health in the longer run using the promotional route. if that's okay. And there's another one which I've kind of uploaded very briefly. Let me just pull that over as well. That's this one. Now, this particular healthcare promotion framework was an article, and I think a particular form of study which is primarily being done across, I think in Australia, if I can remember correctly. And this is more of a holistic paper to try and understand, the learning outcome 4. If you want to understand it from a point of view of what are the key areas wherein, the healthcare promotion framework actually works within a particular, healthcare system. So this in particular talks about, it's a very detailed paper which talks about the topic in unison as a detailed topic, and talks about the entire remits of where the promotions take place, what route it takes, what strategies are involved, and obviously how and what are the effects of this are actually measured when it comes to at various levels, whether the individual level, the community level, or the group level. So this is a different, slightly different, handout, but kind of covers that from a remit of, unison remit of, talking about the topic in one go, but it might be applicable in general to UK. So this is some additional reading that you can look at just to get some more knowledge, but might not be directly related to UK. The King's Funds paper is directly related to UK and talks about the specifics of, looking at how healthcare promotion actually happens within the United Kingdom.
Can you just say what? I mean, I'm very familiar with the Health and Safety Executive.
Yes.
What was the HPSF is what? The Health Promotion and Strategic Framework.
Yeah. This might not be directly applicable to UK, because I think this is something which is been strategically drawn up, I think, in Australia as a framework. So might not be applicable to UK. When you say, if I have to study this, maybe might not have direct bearing on how this is implemented across the UK.
Okay, so that, because it's got German at the top, is that particular health framework is in which country?
I think it's been put together under an initiative by a group of countries in particular, but it covers, if you end up reading the acknowledgements of this particular paper, it basically thanks a lot of people in different countries who have actually contributed to this particular, framework coming across. So there are individuals from it, from Ireland, even from UK, from Germany, Australia, but I think the paper in general has been compiled together predominantly by, a few sponsors or, doctors essentially from some of these countries.
Excellent. Okay, thanks.
So the reason I kind of picked up this particular framework was that if I have to study the learning outcome 4 from a point of view of holistically understanding the whole outcome of how and why the healthcare promotion is important within the context of the international healthcare policy, this particular paper gives you a very good understanding of positioning, and also looking at what are the various ways through which this promotional framework actually works within a particular national healthcare service, or within a context of the combination of hospitals, surgeries. In different countries, obviously it's implemented differently, but how is it offered through that through that framework of the National Health Service. So it has a contribution from many people, but in general, I think the study was predominantly put together by a few Australian doctors, but has picked out some of the best practices from different, because of the contribution done by different people, have picked out some of the best practices which are into play within European.
Another short comment, because in the middle circle there on the front page of the Health Promotion Strategic Framework is a hopscotch. But to my mind, in the UK, hopscotch goes 1, 2, 1, 2 all the way. It doesn't go 1, 2, 3. It goes 1, 2, 1, 2, 1, 2. It's just hopscotch. really go like that in the UK? I'm not sure.
No, I don't think so. I think in some countries, obviously, it
Or
goes
hopscotch.
That's correct, yes. I'm obviously looking at the one which, from an Indian context, goes like this: 1, 2, 3, 4, up to 7, 8, and then you come back. But yes, in the UK, when my kids do it, I think it's 1, 2, 1, 2. Yes, that's correct. So I think from this point of view, I think the study, when you look at reading this paper, you'll feel that the Australian system and the NHS in particular, they have a lot of references in this paper to NHS and on the Australian Medicare system in particular. So parts of this framework can relate to the NHS and in UK in general, but I think will give you a holistic understanding when you want to study something across a broad range of 4, 5, 6 different countries, wherein they've looked at it from a point of view of including some best practices from the US, from Australia, from UK, from Germany, from Ireland in particular, Denmark. And I think again a paper which basically has been put together by a few specific doctors or scientists who worked on this to try and create maybe a international framework of how promotion should be looked at, when it comes to promoting healthcare in general. So this is some additional reading that you can look at, but I think it will be helpful because when you do the assignment, some of the handouts which I would bring across would be primarily because when you want to look at doing the assignments in particular and you look at the tasks, what you will get to see is that you need a bit more reading material and obviously examples. When you explain the theory, what you need is a bit of practice and examples to be able to cover that task off quite well, which can only be done if you have some reading available, from context of understanding the topic in a broader sense. So some of these handouts might not be directly related, but are directly related to when you do the assignments or report writing, for this particular unit. And that brings me to last few slides, with regards to the study which I was mentioning earlier in terms of what are the attitudes towards the pharmaceutical industry. There was an interesting poll which was done by YouGov, which basically looks at kind of studying the the reputation or the kind of let's put it this way, the kind of picture which we perceive of the pharmaceutical companies within the UK. Do these companies really work with NHS? Do they really kind of contribute towards the research and development and obviously bring across innovative products which generally promote good healthcare practices within the industry? And this research looked at saying that the pharmaceutical industry in the UK suffers from many of these reputational trust issues affecting other UK industries. So it enjoys favorably higher trust as compared to some of the other industries. But when it came to measuring this vis-a-vis the perception what individuals have, that is what has been put across, in these slides, is that mostly individuals see the role of, the pharmaceutical industries which work. So private companies working in partnership with NHS to promote healthcare, they kind of feel that socially they are useful but may not be trustworthy. That means most of these companies, like the large ones that we get to see, GlaxoSmithKline Beecham, you look at, AstraZeneca, a lot of people, when they're asked this question, that do you think these companies work with the NHS, support the NHS, generally promote, the objectives of the NHS, the healthcare objectives, they kind of feel that they're socially useful but might not be trustworthy. But the details of that are that it looks at, obviously improving, give me 1 second, sorry. They generally look at improving, the aspect of people's life, but some of them, they generally feel that 50% of them generally feel that they do not kind of, do what they are supposed to do, or they cannot be trusted. And some of the other things which basically you look at is that they have specific attributes. That means most of these companies look at profits rather than ethics. So in the recent news, what we've seen is that, this concept of wherein the NHS is trying to do away with a lot of contractors is because they work in partnership with the private sector, but solely do not benefit the NHS. So there is a good amount of good amount of working being done in the effect of generating profits as against promoting ethics within the working of NHS. So what they feel is the pharmaceutical industry comes unstuck in particular. So 65% of the people actually believe that they are making bigger and bigger profits at a time when profits are not universally viewed positively. So some of the investment into drugs which some of these companies are doing, which are funded through the government in terms of research and development, do not end up having, let's put it this way, in terms of timelines, they're taking more time to develop than it was initially anticipated in the research papers when it was, when they were published, or when these studies were published, seeking the research and development funds from the government. And some of the research and development is actually happening in tandem with the European Union. That means these are projects which are funded by the EU for some of the pharmaceutical companies. So again, there's an issue of trust that most of these companies work towards profit, and if these studies do not lead to the creation of for which the study was funded, the companies end up making profit, but the NHS or the government actually is on the losing side because they've invested the money, but it's not ended up in resulting, for which the money was being paid for. So in general, I think the last slide which kind of summarizes that, although the public trust in these companies is low, but they do generally see joint working between the NHS and industry having a positive reaction. That means some of these, they feel that the private sector generally contributes positively, in terms of working with the NHS. And what I've done in this slide, from which I've taken this across, I put the website here just for additional reading, and the end result, obviously, which is being put across. The result of the study is that 45% of them kind of feel that there are clear benefits to the NHS. 19% are enthusiastic, but believe that this can be better in the future if there is more accountability and more reviews, which the NHS team, which is involved in working within this sector, can take up, so that the money being spent or the funds being allocated can actually be reviewed on a periodic basis, can lead to much higher benefits being gained from such investment done by NHS with these companies. And last but not the least, I think 17% express that joint working sounds too good, but it is primarily inching the NHS towards privatization over a long period of time. So a lot of people are kind of averse to this fact that this private-public partnership within the NHS should be restricted, and 17% of the people feel that this is inching towards more of privatization of some of these services being provided by NHS. Again, this is under the socio-political issues which come under the healthcare promotion, wherein NHS has to, or the National Health Service has to draw a line wherein some bits of it is promoted by NHS, but they need to stop, stop at a stage wherein some of these promotions then become promotions for advertisement, or promotions as an exercise for these companies to generate profits on the back of NHS. So that's the bit which we've tried to look at in understanding how and where it should start, where it should stop, and beyond which it should be left, because at such a stage, some of these objectives do become commercial objectives, and NHS can be seen to be promoting commercial objectives of some of these pharmaceutical companies as against the social message which it tries to communicate under the healthcare promotion campaigns. Is that okay?
Yep, I think so. Yes, I've just got that. Yep, thanks.
Good stuff. So what we're going to do is obviously just stop here for today, if that's okay. And just very briefly, if I bring the spec sheet across for this particular unit. what I'm going to do is...
I'm afraid I can't do that for you.
Right. So here, what we're looking at is learning outcome 3, which was healthcare provisioning last week, and then understand the role of, healthcare promotions in the provision of healthcare services. That is what we've looked at today in particular, and some of the details aspect of, the 3 bits that we have covered this slide, with this presentation and the slides. So we've looked at some of the concepts of healthcare promotion, the framework. We've looked at some of the campaigns and policies very briefly, obviously looking at the breast care campaign in particular, and then some of the social political issues with regards to the pharmaceutical companies is what we've touched, with the last 3 or 4 slides. Now, that leaves us with learning out 5, which is contemporary issues in health and social care, is what we are looking at covering next week. So do you know in terms of next week, what time is going to be convenient? Will it be the weekend, or are we looking at Monday again?
It just depends how keen you are, because I'm off until my next shift is 8 o'clock Wednesday, so I could even slot one in Wednesday morning, but I don't know how you feel. Is that too near?
I think it'll be too near, keeping in mind we've got some classes that I generally take on a Wednesday. So I've got 3 sessions already on business. I'm just conscious of the fact that because Gulshan was, she teaches on Mondays and Tuesdays, and that's the reason obviously she's not been able to take this up. So I can upload the Learning Outcome 5 presentation which I have, which is these contemporary issues in health and social care. It's going to be again a bit of a discussion rather than just going through some of the slides. And what I normally do is when I cover the Learning Outcome 5 is I tend to go through a draft assignment, which will give you some idea of things that we have to refer or relate to, because this particular learning outcome is kind of closely related to the healthcare promotion, learning outcome which we've just covered today. And here it talks about, the practical implications of how healthcare promotions deal with some of the, more precarious issues when it comes to talking about some of the diseases and, some of the issues like which have a social stigma related to it. For example, AIDS, when you look at, or sexually transmitted diseases when we look at. So we have to study, I think, the practical aspect of the implementation of healthcare promotion learning outcome into extrapolating that to, learning outcome 5. If Wednesday is not suitable, can we look at, I would say Wednesday is difficult, definitely. Thursday, Friday, we can look at Friday if that's available, or Saturday.
Yeah, I think Saturday morning then, yeah.
Okay, Saturday morning, what time are we looking at? Say 11 o'clock?
11 o'clock, please, yeah.
Okay, that's fine. So I'll send you the invite for Saturday morning, 11 o'clock. And if you do need any further information in terms of further reading, now I think in terms of a book, what I'm going to do is upload an ebook today, there is one which is already here. I don't know if you've looked at it. This particular book, which is on healthcare policy, related to this particular unit. Some of the topics are covered in detail in this book. You could also look at maybe the handouts that we are uploading, but if you want to start looking at developing maybe and kind of visiting the learning outcomes which have been covered from an assignment perspective, I would suggest that it will be easier that way to kind of recap on some of the things that we've covered so far in terms of learning outcome 1 to 4, so that you're closer to relating some of these things that we've discussed directly to some of the tasks which are there in the assignment brief. Does that make sense?
Yes, absolutely. Now I've just got I'm on Moodle myself at the moment.
Yeah.
Now, if I want to access that ebook, how do I get it from my Moodle? I'm in ATHE level 6. How do I get to that ebook?
Level 6, if you go to the unit, then you click on that, it should open up on your screen.
Well, you clicked on 6.13. Now, hang on. 6.13, I've got up now. I'm just checking yours is smaller print than mine. It goes Danish, yes. I've got ebook, the healthcare policy.
Yeah, that one, if you click on that, that should open up on your screen. And if you want to download that book, you can download it as well. So when you open it up, when you click on it, it opens up. And what you need to do is you just click on it. And when you've got the book open, you click on this down arrow to download it to your local machine.
It says Carol E. Barker, the health, and it's a blue line which is growing, which looks like a download.
Yeah, it's basically, I think it's about 5-6 megabytes, so it will take a few seconds for it to just cache it and open on your machine.
Here comes the healthcare policy process. Where's the slide? Oh, I see the slide bars there. So yes, I can see it's quite big, isn't it?
Yeah, it's about 200 pages. Yes. So what I can do is if you want, I can drop you a quick email with regards to the relevant sections that you have to read. If you want, you want to look at a little bit of in-depth knowledge, there are some relevant sections, obviously, in the book that you can read, which will also help you towards the writing up of the assignment at a later stage.
Yes, please, because I can see it's 203 pages.
Yeah. Yeah. I'm conscious of the fact that, because when you look at this particular qualification, in particular the healthcare qualification, what tends to happen is there are only 2 units which are very directly related to health and social care. So one of them is the International Healthcare Policy, and the other one that we can kind of closely relate to is basically, the one which talks about managing quality and service delivery within the health and social care context. Though the units are written from a generic perspective by ATHE, this one, is very specific to health and social care. So it's a good read if you want to do a bit of bedside reading. If not, then I think some of the handouts which have been uploaded relevant to the learning outcomes that we've discussed, they should give you enough understanding in terms of the current, because the book is, I think, the version of the book is, I think, 2006 or 2007. So I will look at if there are any other current resources which they have published, and if there is a very updated version that I can primarily upload for you in terms of reading. But the handouts that we have put, which have been put in, are primarily, quite current between 2013, 14, 15, 16, depending on the information available, from the NHS website and some of the research papers available. So they are quite current. But I'm going to try and see if I can find maybe an updated resources book, that we can buy and also upload, which will be more current. 2006-7 is, I think, quite a number of years old now. We are into 2017.
That's super. That's fine.
Is that okay? Because I think suggested resources which they put, just kind of quickly open that up to try and see. So we've got, I think some of the books which ATH has primarily published is all within that remit of 2006, 2009. I'll try and see if I can find something which is much more current. But the one that we've got right now put on is the one which is the healthcare policy process, which is Carol Barker's book, which is the one which is published by Sage Publication. Let me try and see if I can pull out a revised version of the same book if we have access to it. If not, then we'll try and see if we can pull together a book which is much more closely related, because there are lots of resources which the awarding organizations sometimes they suggest. But what we try and do is we pick out 1 or 2 books which have, generally tend to have 50 to 70% of the coverage of the content of the, the indicative content in particular of the unit. And that's primarily one of the reasons we must have chosen this book. But I'll try and see if I can ask Kunsh to see if there is an updated version available then and it relates to the current topics of the unit, then we'll make that available as well.
Okay, thank you. Yeah.
Okay, that's brilliant. I'm going to currently